Hi, good morning.
Good morning, doctor.
So, yeah, how have you been doing, Samantha? Are you fine?
Since last week,
Yeah.
well, I had a biopsy. It was a bit sore, very sore actually. But I'm okay.
Alright. So, basically, before we actually move on, do you know that today that we are actually going to reveal the results that we
Yes.
actually did last week? Based on the one that you
Yes.
have? Yeah, alright. So, I just want to ask a few questions beforehand. So, over the past week, just before this, so have you been actually thinking about it? How were you? Just want to know your feelings on these things.
Well, I have been thinking a little bit about it. I mean, a few years ago I had some cysts as well, and they turned out to be okay. So I'm sort of leaning towards it. It will be something similar.
Okay.
Haven't spent too much time thinking about it.
Alright. So basically, you thought probably it might be something like the cyst that you had probably 2 years ago or something.
Yeah.
Yeah. Alright. Okay. So Samantha, I will ask this question basically to all patients before actually give test results.
Yeah.
Are you that sort of person who likes to know all the details of your results? Like, how would you like me to handle the information, basically? Just.
I'm getting worried.
That's alright.
Well, just tell me. What did you find with the cysts?
Alright. You like just to tell you basically the simple things, okay?
Yeah, if I've got more questions,
Alright.
I'll ask.
Alright. Samantha.
Is
okay.
there something that I should be worried about?
Yeah, we are probably not. Well, I just have to tell you the test results first before actually we go on to.
What were they?
Alright, so you actually remember you did an ultrasound, did you? As well as a needle,
mammogram.
as well as a mammogram, as well as a biopsy as well. That takes tissues out from your breast and to send to the lab. The test results actually showed that it's not really a good sign in a way, because it showed a tumor that is basically about 2 centimeters size.
Oh my god.
Yeah, that's in your breast.
Really bad? Is the size of the tumor? Are you saying that it's cancer?
In some reasonable way, yes, it is cancer. Alright.
You don't seem are you sure? Is there a possibility that it's not?
The test results when we sent to the lab has actually revealed that yes, it is indeed cancer. To be an extent.
So you're sure you haven't made a mistake?
Yes, that's actual fact that probably it is cancer. I'm sorry to say that. I know it's.
Oh god.
I know it's hard for you, Samantha.
So how bad is it?
At this stage, we probably don't have to really get too far into that bad side, because breast cancer in itself can be cured in a way. Reasonable amount of patients, they actually can be cured, and with appropriate surgical treatment, basically what happens from here is we need to remove the lump from your breast.
Yes.
Alright, and most appropriately, I will refer you to an oncologist.
What is that?
To a specialist dealing with this sort of cancers. Alright, and he will manage the treatment with appropriate chemotherapy, which basically means taking medicines, just to basically to kill off the cells, as well as radiotherapy, which is radiation as well. And just hope what do you think about it so far? Are you getting this okay so far?
Am I gonna die
actually. It is important to realize, Samantha, that the chances of breast cancer in itself can be cured with appropriate therapy. I can say probably in an amount, probably in 60% patients, it can be cured. Alright, probably in the 40% patients, breast cancer probably spreads. But there is not such a thing that you should actually worry at the moment. Alright. Most important to realize is that breast cancer can be cured. Alright.
Okay. Is there a chance that I will lose my breast?
At the moment, what we would be doing at this moment is to remove a lump, just basically a lump, a small lump that is quite a huge mass, 2 centimeters in diameter, but as well as you said, removing a whole breast is also one of the options that we do to actually treat breast cancer. I'm not sure which is the most appropriate option. Probably the specialist that I'm going to refer to you will have the best option for you.
Okay.
Yeah.
Oh God, I didn't expect that it would be this serious.
Yeah, no. So, do you have a family probably? Do you have any family members that...
I've just moved from Sydney and
Yeah.
I'm feeling quite isolated here in Toowoomba.
Right. You have
I haven't made a lot of friends at this point.
Right, alright. You have a husband?
Yeah. But he's going to have a lot more questions that he'll want answered. He's a scientist himself, so.
Yeah, I thought probably it's best that you actually bring him here as well.
I think he'll want to do that.
So that he knows the condition as much as you do as well, and probably from there we actually can go on to try our best to help you in some sort of way. Is there anything probably you have any more questions or?
Just with how sick am I going to get from all the treatment, and I'm just concerned about my little ones, my family. I've got 4 children. And I don't, what they're going to have to go through themselves, and am I going to be able to look after them, and
Right.
what sort of treatment will be?
Yeah, so first of all, we will manage with surgical treatment, alright, surgery, and probably over the next 6 weeks, I would have to say that the treatment will be a bit unpleasant. In terms of probably you will feel quite sick, and you will have to probably stop working as well for quite a number of months as well. Yeah. Is your husband working as a scientist? Yeah, and you're actually working as well. Okay, this might be so hard for you as well. Hey.
I don't know what I'm going to do. I don't have anyone that can help me, and how am I going to look after the children? I can't expect Tom to look after me as well as the kids as well as work, because we probably have to pay the bills for this. You have a minute.
I know this sounds quite hard for you, hey Samantha. How many children do you have?
I have 4.
Children. And then are they actually quite young?
Yeah, well, I have 2, 14 and 16, and the other one is 6 and 4.
Right. It is important to actually just bring them here as well, so that they would actually blame themselves on the disease that you have.
Why would they blame themselves?
Practically like if small children, they would probably think it's your fault, or is it your husband's fault because you actually get sick. Yeah, because of small children, they actually tend to do that. And so what happens is probably you actually can bring them here and actually can discuss with them the sort of condition that you have. right? So probably that you would get to, so that she can not get too burdened by it. Yeah, so I just hope. So beforehand, I just want to just say that probably it's best that you actually discuss this with your husband and just bring him over for the next appointment and to see what we can actually do from here. That's
Okay.
right. Yeah.
Alright, thank you.
Alright, sorry about that.